I'm Dr. Brad Carafino. I'm a shoulder and upper extremity specialist, and I practice with Atlantic Orthopedics. I'm also a team physician for the Norfolk Tides baseball team and provide medical coverage for some of the area's colleges. I'm going to share with you the case of a posterior labral tear that we treated in a Division I college football player. This particular individual injured his shoulder doing blocking drills where he felt as though the ball of the shoulder was dislocated posteriorly. He had non-operative management consisting of physical therapy, but he continued to have pain in the shoulder associated with symptoms of feeling like his shoulder was popping out of place whenever he would block or tackle. Although I treat posterior labral tears in athletes, we also see these injuries in non-athletes. Individuals can have a labral tear resulting from an injury such as a car accident. To give you some background information, the labrum is essentially the bumper that goes around the socket of the shoulder. So the shoulder is a ball and socket joint, and as I mentioned, the labrum, which is the bumper, goes around the socket and helps to keep the ball in place. Sometimes injuries can result in tearing of that bumper, which is called a labral tear. And when patients have a torn labrum, often they'll have symptoms of instability where they feel as though the shoulder joint is loose or unstable. They also might experience sensations of pain or clicking. The drawing on the left demonstrates a labral tear, and you can see that the black arrow is pointing to an area where that labrum has been torn off. The image on the right demonstrates how a labral repair is performed, and we'll show that further in the surgical videos coming up. But essentially, the labrum is repaired back down to the socket, and this is accomplished using suture anchors which have stitches attached to them, and you can see those stitches in this drawing. So now we'll show you some arthroscopic images from our particular patient. Here we're looking at the socket of the shoulder, which is down below, and the ball of the shoulder, which sits above it. You can see the labrum, which goes around, and here we're looking at areas where it's torn, and you can see the flaps of the tear. Looking at it from a different view, looking directly across, we're seeing the torn labrum, and that's a flap of the labral tissue which is torn and is hanging in the joint. You can also see inflammatory tissue, which is the reddened areas, and that is associated with the tear. Now we're going to begin our repair, and the first thing that we do is we use a shaving instrument to clean up the loose areas of the tear, which is what we're doing here. After we finished cleaning the tear, we then use this instrument, which is called an elevator, and this is used to break up scar tissue that's formed. And the reason that we do this is that we're going to repair the labrum back into its normal position. And in order to do so, we have to break up the scar tissue that prevents us from moving it back into place. So at this point, we now have cleaned up the labrum, we've mobilized it, and we're ready to begin our repair. We'll now start passing stitches beneath the labrum, and we're using this sharp suture passing device to pass an instrument underneath the labrum, which is what we're doing here. And we're trying to find just the right spot to pass this stitch. And after we found that spot, we pass a shuttling device, which is that black loop. And this shuttling device is then used to pass the suture underneath the tear, and that's the suture that you see passing underneath the tear. So this is the this is the first suture that we passed, and we're just getting the stitches organized. And after we've done that, we're going to prepare to pass a second stitch beneath the tear. So again, you'll see the suture passing instrument coming in on the left. And we're going to use that suture passing instrument to go underneath the labral tear. And here we're trying to find just the right spot to pass this suture. And the instrument goes underneath the tear, and we see the suture passing loop coming out. And once again, we're going to use that to shuttle a suture, which you'll see coming in on the right shortly. To shuttle a suture underneath the labral tear. Once again, we're going to just organize our suture tails. So I'm using a grasping instrument here to grab the other end of that stitch, which you can see there. And we're just going to move the other end of the suture to a different spot to allow us to continue to work in the back of the shoulder. So we're just handing the suture off from one instrument to another and placing it in a more convenient location so that we can continue to work. And we placed a third suture, which is the blue suture. And after we place all of our sutures, we're now going to secure those sutures into the bone, into the socket. And by doing that, that's how we repair the labrum back down to the socket. So first we drill a hole, which is what I'm doing here. And this hole is where the suture anchor is going to go into the bone. So there's the suture anchor, and it has the stitches attached to it. And as we place this suture anchor into the bone, it tightens the stitches which go around the labrum. It tightens those stitches down to the bone, and therefore repairs the labrum back down to the bone. So that metal instrument inserts the anchor into the bone, and after the anchor has been put into the bone, we remove that instrument. And then we cut the ends of the stitch. And then we go on to the next suture. And here I've already drilled the hole for the suture anchor. So you can see the white stitch. And the suture anchor that it's attached to is now being placed into the joint. And we put that suture anchor into the bone. And then we will cut the tails of the suture. And after we've done that, we'll go on and do the same thing with our third suture. So moving on to the last stitch, we're going to retrieve the tails of the suture. We're going to pull them out that blue cannula. And then outside of the shoulder, which you can't see on these videos, We then place the tails of the stitch through the suture anchor. So that's probably what's happening right now, is we're putting those stitch tails through the anchor. And then after we've done that, we prepare a hole for the anchor in the bone. So you're going to see the drill coming in soon. So we're going to drill that hole now. And then finally we put the anchor into the hole. And again, you can see that it has the stitches attached to the anchor. And we're cutting the ends of the stitch. And now we've completed our labral repair. So we've repaired the posterior labrum using 3 sutures and 3 suture anchors. So here you are looking at the posterior labrum, and you can see that repair. So that should restore stability to his shoulder. And to wrap things up, to show you again what we've done, he started off with a labral tear depicted in the picture on the left. And we used a technique to repair that tear, which is essentially shown in the picture on the right. So I anticipate that this individual should be able to get back to playing high-level college football with a successful outcome.